So, can I have a motion for the minutes?
So made.
Second. Any discussion? Corrections? All in favor?
Aye.
Opposed? All right, 18-1. You're on.
18-1 is resolution authorizing the reclassification of the RN position that was in early intervention during the COVID response. We pulled the RN that was currently in that position and reclassed it, and it wasn't identified until the budget. We were reviewing the budget, it was identified that it was still an RN line, and it should not have been. So we fixed it with HR. And they said, this is what we need to do, is fill out the request paperwork, and that's what that is.
Okay, have a motion for discussion.
Yes.
Motion.
Second.
Richard?
I don't understand something, because I'm only a poor farmer for telling you, but the thing is this. An early intervention specialist, that person doesn't look at medical needs or anything like that of the issue they're working with?
No, they're working with actually the school on the medical needs, but there are medical people that are involved with those conversations. This person does not need to have a medical background. No. They have to be a specialist within their field, which they are, and we have one that's hired that's doing very well.
Now, is this a college degree type situation?
Yes, bachelor's.
What is the college now, do you know?
Okay. Is that good or bad?
Pardon me?
I don't even know.
Got a deal.
Okay.
Okay.
It's like Walmart, when you find something mismarked, don't advertise it.
She's worked for early intervention for many years, and then when Melissa moved over to preventive as an RN, it was an easy decision to have Mary step into that position.
Right. Any other discussion? All in favor?
Aye.
Opposed? Okay, resolution number 2.
Resolution number 2 is requesting if we could have the LPN line that is currently in our hospice and put it over to preventive services. The LPN that was currently employed in our hospice assisted a lot in preventive and always has assisted a lot in the preventive division, and we've learned that we would like one back. She helps with immunization clinics. She can help under the direction of a registered nurse with FCH visits, the lead program. It's an important position. We're having a hard time filling the RN positions, so an LPN would be very helpful.
Have a motion for discussion.
So moved.
Second. Any questions, discussion? All in favor?
Aye.
Thank
Opposed?
you.
Motion carries.
Thank you.
Dave, you're going to be up because we're going to bring back the Pulaski UV water, don't contaminate the river. We put it off for 2 months issue.
So, thank you, Mr. Chairman. If you recall, this is one that was scheduled for authorization with the other list, and there was some concern about the UV disinfection process, and you wanted more time to look at it. So, in the meantime, I think they should be in your packet, letters from the regional director of the DEC, and also from engineering company that is working with the village on their project, explaining a little bit about the pros and cons of UV versus chemical disinfection. So if you've had the time to look at those. Happy to do my best to try to answer any questions. I'm not a wastewater engineer. I've never played one on TV. I'm not a public health sanitarian, so I can't give you input from them. What I can say is that from what I've learned, you've got a couple of downsides to chemical, which is why a lot of people are moving away from it. One, it's expensive to purchase, store, and handle. It's hazardous in the handling process, and it has potential negative impacts on the receiving body of water. There's ways that they offset those. In this case, chemicals that they use to try to offset one of the damages actually has an oxygen scavenging process. So you take care of the chemical that you didn't want in the water, but the treatment for that also diminishes the amount of oxygen in the receiving body of water. And since this particular body of water, the Salmon River, is lifeblood for the community and very important asset for reproduction of the fishery, less oxygen is really not a great idea for that body of water.
Richard?
Yeah, Dave, you've been in touch with these people and working on this, and you're doing a great job, by the way, so, in my opinion. How old is this water, this bond?
Pardon me?
How old is the bond on this when the water district went in?
I don't know the finances behind their wastewater treatment facility.
See, I'm having a hard time wrapping my head around the fact that, and I understand completely what you're saying. I understand about trying to keep water as clean as possible, and I understand about the salmon and the money and all that kind of good stuff. I get all that. What I don't get is why we didn't do this, why that wasn't done at the onset when this sewage treatment plant, basically what it is, when it was put in.
So the UV disinfection process is relatively new, but it is one that is widely accepted, and as people are redoing their systems, it's very common part of the replacement process. So for example, the project we're working on in Phoenix to upgrade that plant, that project also includes a change from chemical to UV disinfection. It's the new way, right? So it's less hazardous for your employees, less expensive storage. You don't have all the OSHA issues to deal with, and you don't have the chemical concerns on your effluent as well. So
This is monitored every day.
yeah, it's adjustable. So like when your flow is higher, then the UV process is stimulated further. So it monitors the flow as well and treats it at the same level.
Questions? Yeah, go ahead.
Not a question, just my comments and concerns and feelings. I think I just, this little boy here, but I've been around the city of Fulton long enough to know what they've gone through with their wastewater treatment plant, okay, with them going through all the different upgrades that they've had to do over the past. I've been down there for 20 years, so I've seen what they've had to go through. And each time they had to do that, they had to go out and bond for it, grants for it, raised the wastewater fees to the public. And for those reasons, I can't see why this wasn't done through, by the last guy. Okay, And you guys know my feelings about this ARPA money. It's supposed to be for things that happened during the pandemic that caused them, this isn't something that happened during the pandemic. This is something that was, it's something we need, yes. And I agree that it has to be done for the water. That's not my point. I'm not against that. I'm not against doing something to make the environment safe and be able to use that to swim back into that system that is very, very important to everybody, whether, they're up there in Alaska or not, okay? But it's the fact that they've known for a while that they would have to improve on their treatment of that water that comes from the house and goes back into the river. And now all of a sudden they're asking for money that could be used to somebody that lost money during the pandemic. Yeah, this is not the case there. This is they're grabbing it. There's the ring when you're going around on the merry-go-round, and they're grabbing at it. They're going to use it just because they can. And I'm sorry, I can't be in favor of that. I agree with reason, but not for using our money for that. That's it.
I'd just like to say that I think ARPA money is appropriate for this project because it is for the common good, it's for the public health. We're all drinking water out of this lake. This river's flowed into that lake. If we can limit the amount of chemicals going in, eventually we're going to have to stop them all from going in. Because guess what? We're all drinking it. So if we can do anything, this is the common good. It's for everybody. So everybody drinks water in that area, drink water down here. I know it's wastewater there, but it's all going into that lake, and that's where we're all getting our drinking water from. So I think it's the general health of the entire population. I think it's appropriate for all the families. Thanks.
I do have one question when I read this. Under the disadvantages, is there a trip point there that if they go over that 30, because they're saying typically they're less than 10 right now. The reason I have that little bit of concern is I toured the new housing complex out on the edge of town. I don't know if that's connected to the sewer system or not. I suspect if it's not, it will be. And that will bring other development out there. And that's a huge complex. I don't know if you've seen that or looked at that, but that's not Chateau. It's 2 to 3 times the size of Champlain or whatever you call it. Champlain. Should be Chateau. Maybe it would have been a better project. I don't know. But it's massive. So I looked at that, and is there a trip that if they get to that, they say it renders it ineffective? Is there a trip for something else on that, or did they say? And I mean, right now that's big variance between 10 and 30.
Right.
I get it, but if that continues, I mean they're not even putting people in the apartments yet,
Right.
because 9mo hasn't put in the utilities. But eventually that happens, and then eventually you're a fool if you don't build a convenience store next to that thing. And then it's going to 2 or 3 more things, and then there's already talk of another housing complex.
Right. So I don't have the direct answer to your question. I'm not familiar with their other long-term plans for expanding the conveyance system in what areas that they want to pick up, but I can tell you that there's a lot of activity and interest in the Salmon River corridor. There's also potential, and they have mentioned this, maybe not in this committee, but as an example of trying to grow the infrastructure within the county. There's an industrial plant at the sugar paper facility that is not being used or being used very little and pretty expensive and ineffective at the quantity that they need it for right now. So there's been some at least initial discussions about potentially acquiring that plant, converting it to municipal, and tying it into the Pulaski system so that you can spread out the needs for these other developments across 2 facilities as opposed to 1. So those types of growth questions, I think, there's a couple ways to address those. But I don't know specifically what the Alaska long-term plan is. That they have a wastewater committee. That wasn't part of their application. It was specifically to help them with this project that going forward. It's wastewater is one of the things specifically identified in the ARPA legislation, and not everything has to be tied to the pandemic if it's otherwise identified as a priority, like wastewater, broadband, travel, tourism, hospitality. If by chance they get tied together, that's great, but with respect to infrastructure, many of these projects that we've had requests for, they've been in the planning stages for years. It often takes 2, 3, 5, even 10 years before you can get the funding together to a point that a community can afford to take the project on. Other times when there's emergency situations, they have to bite the bullet and borrow the money for it. But they're long-term things and not. There's plenty of requests that we have had that are similar that people would say, well, how is that tied to the pandemic? Public safety. Somebody wants to buy a new fire truck. They sent us a request. Was it pandemic related? No, the fire truck's 30 years old. Whether we decide to fund that or not, that's choices for you, but there's allowable expenditures under the law that you can consider. Some you may approve and some you may not.
Yeah, one comment. When they're talking at TSS, I used to work in a plant where we had our own facility for removing dust. We used to have to take our ink and send it through a system to purify it, pull up the waters, send the waters into the filter system actually. And we used to have to send it in cleaner than we got it. The TSS, if that's what they're trying to do is pull out solids. If they're not pulling out the solids, they're going to know immediately. But that means they've got to add more screens or more, depending on how they're doing it, pressing it, or whether it's a conveyor system. That's not a difficult thing to remedy. If they get up to 30, that means their system broke down. It's not working. So they'd have to stop and fix it anyways.
So it's a real high benchmark.
Yeah.
Okay.
And then what happens is you pull out your solids, which go to a landfill, and then you send your water through, and it's checked. We usually have to send it out to the lab all the time. Whereas in this case, they're hitting it with a UV light to cure it. Any solids in it. 10 SS, DSS.
I was just looking at the two and then looking at what potentially down the road is coming in that area.
It just means they have to either slow the system down or add more screens or whatever their process is to go on the solids.
Frank?
Just want to add a little bit. I don't take anything personal. Okay? The issue that I look at is that the amount of money that we've given out in that first round to a lot of these corporations, that was large amounts of money. Now there are small companies, restaurants, that are not going to be eligible for any money, or they're going to be eligible for only for small amounts of money, and they lost large amounts of money because of not being able to serve people, only cut down on a certain thing, losing people, losing work. One gentleman, one place in business that I told him, I said, call and see about getting some ARPA funds, because if you want to put in a gas station over here, it'd be the only one on the east side of between Minetto and what's that road up there, Lamson Road, in the city of Fulton. Okay, and It was the fact that, well, we'd rather give it money to, a couple thousand, 50,000 there, 30,000, which isn't gonna help that guy put in those gas stations, those gas pumps. But these are the issues that I'm looking at, is that I look at, that I saw the list, went down through that list again, where, some of these corporations got so much large amounts of money. And they weren't affected as much as the ones that are now in the city of Fulton. You go through Fulton and you know yourself, Nate, you got down there in downtown Fulton, which used to be downtown, we've got more empties than we've got fills. And we've lost restaurants, we've lost it. Why? Because they couldn't sustain, whereas the corporations did. And that's the only reason I won't be in favor of this. There's also wasn't there one for Richland? Didn't Richland put in for what? Wastewater treatment or water treatment plant? There's two of them in the list that we got.
Richland had,
They had a request,
water district and some other things, that's what was approved, right?
Okay, all right, that's all, and I know how important to have clean water and infrastructure. That's very, very important. I understand that. But I'm just looking at this, people that are hurting. That's all. Thank you, Greg.
So just because I know that you all get questions from your constituents, let me clarify a little bit about the ARPA money. It's not an economic development fund. There are ways you can help businesses, but you can't just say, well, it'd be really great if we had one of these things and this guy wants to do it, so let's just give him some money. So I'll try to make a simple example. Let's say that you have a restaurant business and it's been around a while and you've got a walk-in cooler, but it's really outlived its purpose, and you were ready to replace it prior to the pandemic. And you had a price for $30,000 to put it in your cooler. Well, COVID comes, everything gets shut down, you don't do the project, now you open back up, you still need to replace that cooler, but the cost now is $40,000. So one of the ways that you can help people with the ARPA money is to help offset the negative impact of the pandemic. So you can't give the guy $40,000 to buy the cooler, but there's clear evidence that it now costs him $10,000 more. That's the harm that he endured from the pandemic. So you could help offset the price increase for what he had proposed to do to what the new cost is now. You can't have assistance that's disproportionate to the harm that they endure. So there are ways, but you can't just say, well, we wanted to do this, and why don't you just give us some money? You've got to make it fit within the confines of the law.
Any other questions? So we can vote on this, right? I have a motion to take.
No, we need to untable.
Take it off the table.
I need a motion to.
So made.
Second. All in favor of taking it off the table, so we can now vote. All in favor?
Aye.
Opposed? All right. Congratulations, you can tell them that we're no longer assholes about it.
Would it be okay if I chose a different method?
Yeah, go
A different adjective.
Yeah, I've gotten a couple people that contacted me back and said, what are you doing this?
Different now.
For the record, you may choose that adjective for your own description of your colleagues, but that's not what I use.
I wasn't talking about my colleagues, I'm talking about what they called me. I think the colleagues did the right thing, holding it until we thank you, everybody. So now, we are to, well, I do, that's up to them.
No. What do you guys want to do?
Want to do Super Dirt Week first? Do you want to go first? Or do you want to do Water Freeze?
We did the summary first, and then okay, so I'll do the summary first,
Okay,
and then we'll do dirt.
okay.
If Judy was in a hurry, I had hers on first. So our update on hospice, we currently have 1 patient on our census, and we do have 104 open bereavement cases. 2 more staff have taken other positions within the health department. We were having difficulty filling a request of hospice services in our eastern part of the county, and I was able to work with New Hartford Hospice, and they are going to cover that area. They are working with New York State Department of Health. Same deal as Jefferson County, 5 patients when the doctor makes a referral to them. So we feel better about that because we don't want anyone in this county to go without services, that's for sure. Preventive update, flu vaccine. We're starting to get that in. High dose is on hold until the end of September, beginning October. That happened last year also. So that's the flu vaccine that's for our 65 and over population. As soon as we get it though, we'll start having those clinics. That's when the health department's open daily for flu vaccine. We're also gonna provide vaccine to the county buildings throughout the county. We're going to do our homebound population, also work with adult homes, same as we've done in the past. Monkeypox update. We don't have any cases, just so you know. Also, there is a shortage of that vaccine. While I'll say the supply is limited, they're only really distributing to counties that have a positive case. So we're not even on their radar at this point. We are encouraging all of our partners that work with this population to provide people with the information they need. If they believe they have an STD, go in, get tested, because most likely it is monkeypox. Monkeypox is not being identified as a sexually transmitted disease, even though it's the same signs and symptoms. Polio, I talked about polio being identified in the wastewater plants down south. We do not have a positive polio case. None has been identified in Oswego County, but we did order extra vaccine just in case family members can't find their vaccine cards. Our rates are very, very high compared to New York State and neighboring counties, but we wanted to have some on hand just in case. COVID changes with the isolation quarantine orders have came out. We did update our website to keep current, also with the school guidance. We're very thankful that New York State Department of Health did put the guidance out to the start of the school year, and they are also referring them to the CDC guidance. They eliminated test to stay, which is wonderful. They are doing away with the quarantine after exposure, but they are promoting wearing masks in school if you were exposed for 10 days. No more masks. That's really up to the school if they want to continue that, but we are not recommending them. We are going with the CDC. Also, they eliminated social distancing requirement and shortened the isolation to really 5 days now. So isolation for 5 days, that's really what we've been doing anyways, but the CDC, that is in the school guidance also. We are seeing higher numbers for COVID, just so you know, compared to last year. Our hospitals are not overwhelmed at all. We are seeing more cases from people being hospitalized not from COVID, but with COVID. So they're going in the hospitals, they're in labor, they do a COVID test, they're showing up positive. So less and less sicker. Hospitals are doing outpatient procedures, they're back to running. But I think they still are limiting the visitation. It's not a free-for-all, everybody just can't go to the hospital. And I don't see that changing in the near future. Healthy Families Oswego County, we are up and running. CCE has hired a new program manager to take over Lauren. Lauren was a long-time person with Cornell Cooperative Extension. She did take another job. This was another hit to our Healthy Families, but they did hire someone, and they actually hired Chelsea, which actually is fully trained in Healthy Families. So that was a breath of fresh air, knowing that Chelsea is taking over that program with CCE. So we are going to move forward full bore for this program. That's our Prevent Child Abuse program that's very important. The state came in and did a survey early August. We're still waiting their results. As soon as we get them, we'll start doing our improvement plan based on their findings. Our environmental division, I'm going to report on a little bit and then we'll get to the division. Our county fair, our sanitarians conducted our agricultural fairgrounds operations certificate class for 3 fairground operators this year. 13 food vendors operated at the fair, no issues at all. In addition to the food service, we inspected water supply, toilets, hand washing facilities, campgrounds, the dormitory, roadways, fire protection, animal waste and storage, and disposal. Setbacks that were identified in 2022 with a negative effect on attendance and food concession sales were, it rained. It rained that weekend. And then the carnival rides were delayed the first day and a half, and that was because the New York State Department of Labor didn't do their inspections timely. Rabies statistics for 2022. We held the 6th rabies clinic on August 10th. We have 2 more to go, one in Minetto on September 14th, and one in Pulaski on October 19th. Our rabies field coordinator, Zeke, will be conducting a rabies presentation with the Trapper Association convention, and I believe he does this every year right at Camp Serby on the 16th and 17th of September. Mosquito surveillance has been at the forefront of everything recently, just so everybody knows. The status of mosquito surveillance since last Friday, and much has changed in the last 3-4 days, but we just don't have results yet, just so you know. So the mosquito population has remained very, very low throughout the summer. It's a hot, dry summer. The populations are low. When we get a pool of mosquitoes, our pool numbers are down because we have to have at least 50 mosquitoes to, no, a maximum of 50, but a minimum of 11 mosquitoes. Some mosquito pools were only getting 6 mosquitoes. So it's taken us a full week to get one pool compared to years past. We would get 23 pools of mosquitoes. This in 1 week. This is a very odd year for mosquitoes. But Triple E is present. We have found it sporadically and scattered throughout the county. Even though the viral activity is really low, as we've been seeing in other years, usually we have already sprayed. We've had 3 positive West Nile pools and 6 Triple E pools. But again, our numbers are very low, and it's not, they're scattered. I did request for the New York State Department of Health to declare an imminent threat to public health, which they granted us. I was thinking we were going to spray last week. Then we only got 2 pools, one West Nile, one Triple E, in different locations. So we're ready to spray. We want to spray. We just have to set a location, wait on this week's lab results, which last week we received them on Monday. This week, I was hoping Monday, but we haven't got them yet today. So we will see what happens. And then on Friday, we did have a horse that was a young foal that was not old enough for vaccine, did pass away. The labs were sent, and we're waiting on those results. Again, we were hoping that we were going to get them yesterday. We have not received those results yet. If the horse is positive for triple E, we do have a plan that that's the area that we will be spraying. I don't think anybody would deny us that right, or say that we're silly to spray in that area. That's the area we need to spray. Chris has already been in talks with Mr. Duflo to have everything ready to go, but I guess we'll see what happens. And I don't have any results again this week yet. There's also another horse that is sick in the area that has not died that I know of yet, but we are watching them. Just so you know, there are neighboring counties that have had sick horses that have went down. Jefferson County has had a positive triple E and a horse that I do not put, and that just happened. That I just got reported up this morning. Any questions about triple E? That's a big one.
They have vaccines for this.
Yes, they do. The one that
Amish horses that are going out?
the one that we're watching right now is an Amish horse. The foal is too young to be vaccinated. The one that passed. The mother also became sick, but I don't think we could get a viable sample from that one. Children's camps. I'm going to do children's camps, Meyer camps, and Super Derby, and then we're done. Children's camps. There are 18 children's camps here in Oswego County, 14 day camps. We do have 4 overnight camps. All children's camps ended last Friday on the 26th. There were 6 reportable incidents, 3 injuries, and then we did have 3 illnesses reported, and they were all COVID. The migrant camps, there are 12 migrant camps. All were inspected, and 22 except 3 that we're waiting for our seasonal workers to come in and then they'll be inspected. Any questions for me so far?
No, I have one. I have one. No, COVID.
Mm-hmm.
Have we reached herd immunity? I mean, nobody's dying from this, correct?
There's treatment out there.
I mean, what's the CDC saying? I mean, are we hearing anything that
No.
we haven't reached herd immunity yet?
No, they're not saying they've taken that out of the definition just
Oh,
because
okay.
they really have. Just because there are breakthrough cases, so many of them, because the virus keeps changing.
Right.
So it's more going to be like a flu,
Right.
which everybody said in the beginning. So.
But nobody's dying.
We did have 1 death, but they did have a lot of comorbidities. They are calling it a COVID death. So
They had a heart attack, but they also.
And a bullet hole in his head.
It's just because.
No, I know. I got you.
That's my job. A couple of years ago, the flu, the vaccines for kids in school, you guys were kind of swamped with the telephone calls of, gee, they just kicked my kid out of school because they don't have the vaccine.
Yes.
Are you ahead of the game?
we're still ahead of the game.
Okay, so
Yes.
you don't anticipate a lot of that?
No, and we're doing 2 after-hour clinics just for children, and we ramped up a lot of clinics the week that they all get kicked out.
And I know that when that happened, you guys did a lot of education of, look, this isn't us. You need to get in here and get it done. So I'm glad to hear that, because that was a mess.
It was a mess, and yes, we did we are anticipating that. We don't want it to happen again, so we're ready.
Okay. Anybody else? Now for the excitement.
Do you mind if I use the?
Oh, yeah, if you want the,
Whichever one fast forwards the slides.
I mean, they both do. I mean, I feel like I never ever use that. but-
Okay, so, thank you for letting me come and talk about Dirt Week. I don't know if you've heard much about it this year, if anyone has gone to the actual legislature and spoken, but I was gonna do an update today. Vera asked me to cover our role in mass gatherings, but specifically for Dirt Week. So if I get too in detail, you already know this stuff, just wave me on. Enter. All right. So what is a mass gathering and why do we even get involved? Well, there's a New York State Sanitary Code subpart 7.4 that covers mass gatherings. And it has 4 components to the definition. Number 1, it has to be a public pre-planned event. And then it has to be in a specific location where there's like that controlled entrance, where there's a gate or tickets of some sort, where you go into the event and you have to be, and you're counted. They can control entrance that way. It has to attract at least 5,000 people, sorry. I'm gonna look at this because it's too far away. 5,000 people, and it has to last for 24 hours. That means it's not lasting 5 days a week, but you are actually staying on site for a 24-hour period. So there's camping of some sort on the grounds itself after you enter the event. These are the mass gatherings we've ever had in the county. The big one was Fish of 100,000 people back in 1999. It's before my time, but I do remember all the cars lined up on 481. Then Crocathon, these are getting smaller and smaller. Crocathon was a concert held at the Speedway. Oswego Bike Fest was in 2013, also at the Speedway. They thought they were going to have 5,000 people, but attendance ended up being much less. And finally, Super Dirt Week has returned to us every year since 2016. And this is the one that I'm going to talk about today. Our goal is to minimize the risk of injury and illness, but also to maximize safety. And that's not just to protect attendees at the event, or the participants, or the actual racers, or the promoters. It's to protect our whole community. Because when a mass gathering comes to our community, it will tax our resources, our medical resources, as well as the infrastructure of the area. So it's the racing's biggest party, and it just got bigger because it's the 50th anniversary. It's a big deal. It's not just campers coming in Sunday and there's a little bit of activity until the big race on Thursday, Friday, Saturday. There's going to be events not just on-site but off-site. The anniversary trophy is one of a kind. It's only going to be used this year. It's really got a lot of meaning behind it. We don't have time for that today, but you probably know about it. The top is the Steel Palace, our speedway track. The bottom black part is Moody Mile down in Syracuse. Many other little hidden meanings in it, and it means a lot to them. There's going to be a charity golf course at Radisson Greens. There's going to be a charity pancake breakfast. The city is going to hold a parade. It's not just going to be the cars going through, and that is presented by HarborFest. They became a new partner, so Super Dirt Week sent their cars to HarborFest, and HarborFest is going to help them with their parade. There's going to be past champions coming back and having their very own race, and that's exciting to people that are into racing. I'm not into this stuff, but I can really appreciate how exciting that must be because it goes all the way back 50 years. They're not all with us still, but many of them are coming back. There'll be autographs, there'll be special presentations and gifts for the past racers. And that's a big thing if you're into this. There's going to be a Saturday night bash at DJ is the name of the group. It's not just Saturday night. And Dirt Road Ruckus is another concert, so they're going to be holding those
in the track itself, at the track itself. And Jeff Hoffman, who is the administrator, the promoter, as we always refer to him, is working with the Pentagon to do a flyover during the big race, possibly 2, but that's all got to be cleared, and that is his big secret that he's hoping will go through. So they have to apply. They have to get a permit, and that comes from the local health department. It's not a 2-page permit. This is their application right here. Lots and lots and lots of documents. We have to work with partners in the community to get all these documents. I'll go to that real quickly after I go to the next. Another permit has to come from the health department, not local but state, and that's the Part 18. This is the one that also goes to Harbor Fest. Harbor Fest isn't a mass gathering for 2 reasons. It doesn't have controlled access. There's no gate you go through. It's all over the city, so that leaves it out of it. And it also is not a 24-hour camping event. You don't go to Harbor Fest and camp there all night. But Part 18 captures that. So this is the EMS, the medical services, and emergency and disaster response. And all this stuff, the health department has to make sure it's in place, the local, but we don't have this expertise. So New York State Bureau of Emergency Medical Services and Trauma Systems will come in and meet with the promoter. The promoter's responsible for putting this all together, but he can't do it and we can't do it without each other all coming in and working together. And these are our partnering agencies, county, state, and also the local municipality where it's held, in this case, City of Oswego. So we're working with everybody, and each one has an expertise they bring. Help Jeff put this together. Jeff has an engineer on staff. They do all the calculations for the number of camping sites, number of people that can be in certain areas, and then that engineer makes sure everything's in here as required by code, and we'll sign off on it. And that's when we say your application is complete. That usually doesn't happen until just before the event. The majority of it, this is last year's because it's half the size now, but I wanted to bring the 2021 so you see how much work goes into it. The IAP, the Incident Action Plan, will change right up to the event. Sometimes it changes during the event. So that is something that keeps getting worked on and can never be done 45 days in advance like we would like this to come in. The other permit that comes from the local health department are any food concession permits. Just like any other fair festival, you apply for the permit, we issue the permit, and we go out and inspect. This was wonderful because the engineer was super dirtly, was just gracious enough to make these. A lot of people got them at our planning meeting. Dave, did you get all the ones you asked for?
Yes, thank you.
Okay, and if you need more, the engineer will make more up, so just pass the word on to us and we'll get you some. He'll do the laminated ones, he'll do the cardboard backing ones, he'll also do folding ones. So this is a speedway, and everything in color is super dirtly. They actually rent the facility, and it's no longer the speedway, it's super dirtly. So I'll go over here with you guys. Camping is here, and camping is here. This is the permanent campground. The speedway was proactive. They put in a permanent campground. It has about 121 sites with sewer and water hookup. This is the one that's behind the owner's home. There's a little bridge that goes over, I believe that is, anybody know the name of that little river that goes through?
Wine Creek.
Thank you, Wine Creek. So you go over the little bridge, and then there's camping as well as tent camping back here. This is the family camping. They try to keep it calm, quiet. And then there's camping areas off-site, and that's not part of Super Dirt Week. Those are private campgrounds. We haven't had any spring up. where they just want to operate during Super Dirt Week this year yet, but sometimes it happens, and then we work to get them a temporary type of campground. Go ahead, open the door. Thanks. Okay. Here's camping. It's not a real campground, except for the black campground, which is the Speedway's campground. It's on uneven ground. So you're gonna have situations where they're gonna have to level their units. They're gonna have spacing, because there's propane and there's campfires, barbecue grills. So we don't want to fire jump from one to the other. The way to avoid that is a 10-foot spacing. And you can see over here that not only do we have RVs, but the camping tents come up, as well as parking. You get to park with your RV or with your tent. So they're planning, and we're planning, and we plan for a maximum amount of people. They're expecting 12,000 in the grandstands, because that's all it can hold. And then there's 961 RV sites, campsites. So you figure there's about 2.5 people per RV site. So they have to limit attendance, because all this medical planning and all of the toilets and water coming in is for a specific amount of people. And this is how they do it. You'll get a wristband when you come, and if you take your car in, you get a parking pass. That way you can leave and come back. You don't have to stay on there the whole 9 days it lasts. And if you have a golf cart, you have to get that registered with them, or you can rent a golf cart from them. And I'll do this very quickly. These are the things you typically think that the health department's going to do. We have to have toilets and hand washing and trash disposal. Not just for one day, but for the whole week. So there has to be proper collection and storage and water supply. Funny thing about the mass gathering code is they have to supply free water. But they can also sell water too. So there are permanent water spigots in the back of the grandstands. There's permanent ones for the lucky people that are in the black lot and in the actual hookup campsites. But we bring in a bulk water hauler. And he puts this one, the little dome one, in the campground that has all the tenters. So they have a place to go for water. Most everybody brings their own, but if need be, it's got to be provided by the code. This is the water truck. Looks like a big milk truck, but it's a water truck. And our bulk water hauler is really cool in that he hauls water in another tank and goes up and down all of the rows of campers. If you want to buy water and replenish your water because you're there a week, he will do a fill up for you for a certain amount of fee. Same thing with the septic. If you're parked there all week, you don't want a full tank building up of black water, so you can have them come, sign up, and they'll pump out your tanks for you. This is all the stuff that makes this a cool place to go and not a big disaster like Woodstock and so on. A lot of planning. Medical response and communications. This is fire and EMS. They all work together. E911. You see all the radios. They've got to communicate if something happens and they need to respond. They've got medical gators and they've got ambulances for off-site transport. Fire also parks on East Albany Street. What we have is a bunch of really fast cars, a lot of racing fuel, propane, and fires at the campground. So this is a necessary thing. And then security. They take the community school on City Line Road and turn it into a security headquarters. Down below, they operate out of the basement, and they make up maps and quadrants so they know if they're called to an area, where to go. They do their hash, powwows, they do all their planning on a daily basis down there. And then Super Dirt Week or World Racing Group every morning will hold a huddle where they'll talk about the day before, what's expected that day. So this is an important part, and each agency can have a representative go there. The health department goes, and that's our staging station where we keep the plan and we also keep a map and our radios. So roadways, we've got to be able to get in there. The emergency medical responders have to be able to get there. What if there's a heart attack? What if there's a fire? And then also, Albany Street, East Albany Street is closed. Takes a resolution and permission by the mayor and also law enforcement, city police. To get this closed, it becomes a thoroughfare. That's where all the attendees are walking up and down between the campground and the actual track itself. Golf carts are going up and down that area too. It's all part of that contained area we talk about, where you have to enter through a controlled point and stay in there. If you go out, you gotta have your identifying risk tag or parking pass to get back in. And then the other thing is transportation. You see how big that area is on the map. So to get from a parking space way down here, which is where some of the parking is, to get all the way up to the track, it's an uphill walk. Sometimes it's difficult. Am I hitting you? Not at all. Okay, so they've got trams, and the trams will pick you up, take you to the gates, take you to your camping spot. They'll not just take you to the spot, but they'll take you to where your row begins. And then there's also shuttles. The trolleys are there because we also have non-contiguous parking at Spread Highway. Long distance coming in, and the whole point of it is to get the cars out there and bring the attendees back. So the trolleys serve this. It's a free of charge thing. It's all cars, super perfect. And pay no attention to these slides. The one on the left that's the setup for the health department, where we set up in the school in the cafeteria. The other one I started to put it in. Code enforcement also has to look at all the structures and the infrastructure at the speedway. One of the big projects they had over the years was redoing the back grandstands because they were deteriorating. So they go in every year to make sure everything's okay. And here's the big question, are they coming back? Well, we were told at our last planning meeting that they're guaranteed at least a couple of years at the Oswego Speedway. I think there's more years than that left, but they're guaranteeing at least 2. And whether it stays here or goes to another part of central New York, I don't know, but they want to keep it in central New York. No rumors about them leaving or where they're going that have reached my ears anyway. So I'm sorry, I go on all the time. I get really excited about this thing. It's really good for our community.
Yeah, Rich?
One of the things I'd like to mention is the county also has a local law on mass gatherings, and the promoter funds an escrow every year. We'll be doing that again. And secondly, if the Scribe Highway facility is not on the infrastructure agenda for this afternoon, the committee should vote to give them permission to use that because we have a separate agreement we have to enter into for Scribe. Yeah. I'll send an email to the clerk. Right.
As a general point of interest, you heard Judy mention that 961 campsites. At our last meeting a couple weeks ago, they had confirmed that every one of those is sold out already.
And it has expanded. They started out with 700 campsites, and now they're up to 961 by just building these new campsites, like behind the Speedway owner's home, and just finding more innovative ways to still do the spacing, keep it safe, but add more camping. They added groves too, and they built it up, and that allowed them to use a lot of the lower lying property, where if you put a camper down there, you might not be able to get it back out if it rains and if it's all muddy.
If you open the campground without an event, the health department still regulates that independently of the mass gatherings. It's a separate part of the code.
Any questions? That's the end of the agenda.
That's a great job.
That was good.
Thank you. It's very, very nice.
Also, put this out there. Anybody that wants to take a tour of Super Dirt Week right before they open, Jeff will be getting trams and trying to get everybody that wants to do it on a tram, and he'll give a one-time around, show you the dirt track, show you where the camping is. And if you want to do that, just through Vera, just let me know and I will get you the invite. The date's not set. It's going to be late September or, well, the first day is October 2nd, so it's got to be before that.
Have the appropriate motion.
So move.
Anyone vote against it?
Oh, no.
Then we are adjourned.
Wrong hand, wrong.